This video discusses the possible treatments and preventative measures for COVID-19. There are many treatments that are being developed for COVID-19, but not many treatments have been approved yet. Many times, medical intervention is not needed for a COVID-19 infection, as the infections are mild, but it has been difficult to come up with treatments when they are needed. If the infection is serious, oxygen is used to keep the patient's oxygen saturation up, due to it being a respiratory disease. Dexamethasone can also be used to help one's breathing if needed. Finally, some people may need to be intubated if the infection is severe. There are also many potential drug treatments that could be used to fight COVID-19. However, not many of them have been approved yet or are being used, as many are still being tested. One of the main treatment drugs is remdesivir. The actual name of the drug is remdesivir triphosphate, meaning that it has 3 phosphate groups attached to it. Many studies have been done on it, and it has been shown that it speeds up one's recovery of COVID-19. It has also been getting more and more attention lately as a treatment option. How it works is that it inhibits RDRP, which stands for RNA-dependent RNA polymerase. This is a non-structural protein that synthesizes the viral RNA. Specifically, remdesivir gets incorporated into the viral RNA because it looks like an ATP molecule, as it is an adenosine analog. Once it gets incorporated, it inhibits the rest of the RNA replication, as no more RNA blocks can get added at this point. Furthermore, both remdesivir and chloroquine have been used together as a treatment option to prevent replication. Another treatment drug that could be used is favipiravir. This is similar to endogenous guanine, which is a nucleotide or a building block of RNA. Therefore, it acts like remdesivir by inhibiting RDRP and therefore viral replication. This drug also has few side effects. N3 is another drug that has potential to treat COVID-19. It works by inhibiting the main protease as it binds inside the substrate portion of the protease, therefore inhibiting it. Additionally, 11A and 11B are some other drugs that could be helpful in this infection. These drugs also inhibit the main protease, Specifically, drug 11A has quite low toxicity. The mechanism of inhibition is that the drug's aldehyde group binds to cysteine on the 145th amino acid of the protease by covalent and hydrogen bonding, thereby inhibiting the protease. However, these drugs have only been tested in vitro, meaning that it has not yet been tested in humans, but it has worked in the lab. Another drug that could be useful is camostat mesylate. It is a TMPRSS2 inhibitor. TMPRSS2 and TMPRSS4 are proteases which help with the fusion of the virus into the host cell. Specifically, TMPRSS2 primes the spike protein. Therefore, this drug can partly prevent the virus from entering the lungs by inhibiting the spike protein, which allows entry into the lungs. Another drug that could be used is Carmophor. This is an anti-neoplastic drug, which means that it stops cell proliferation and is used as a cancer drug. This drug inhibits the main protease in vitro. Specifically, it is a 5-fluorouracil derivative, which is also a cancer drug. It is not really known how this drug works. Possibly, part of the mechanism of inhibition is that the fatty acid tail of the drug goes into the S2 subunit of the protein. Lipopeptide EK1C4 is another drug that has potential to treat COVID-19. EK1 is a fusion inhibitor in 5 human coronaviruses, and it interferes with HR1 and HR2, which form 6-HB. Specifically, HR1 of the S protein is the target of this drug. It can also inhibit membrane fusion by the spike protein as well. The lipopeptide EK1C4 is where EK1 has a cholesterol attached to the EK1C terminal. Finally, bamlanivimab is also a treatment for COVID-19. It is a monoclonal antibody that works against the spike protein, meaning that it is anti-spike. This drug is used for mild or moderate sickness of COVID-19. These are some of the potential treatments that could work for COVID-19 due to their known properties or as shown in studies. As seen, there are many potential drugs that have the potential to be used as a treatment option. However, there are only 2 authorized treatments for COVID-19 in Canada, which are remdesivir and bamlanivimab. Remdesivir is for severe illness of COVID-19, where bamlanivimab is for mild or moderate sickness of COVID-19. In addition, dexamethasone is also advised to help with breathing problems. These have been some of the potential treatments that could be used for COVID-19, as well as a few that are authorized to be used. We will now talk about some of the preventative measures that can be taken against COVID-19.
So how can we help prevent the spread of COVID-19? First, wearing a mask can be a useful piece of personal protective equipment, or PPE, to limit the spread of COVID-19. Masks help by blocking the transfer of droplets from you to others, which, when used correctly en masse, it can effectively stifle the transfer of COVID throughout the population. Another very simple way to preventing the spread of COVID-19 is to stay at home when you feel unwell or have any of the symptoms of COVID-19, and to tell other people who you've contacted recently so that they also can get tested or isolate physically. Furthermore, with the rise of variants and the reduced effectiveness of vaccines for COVID-19, social distancing is becoming a larger factor in reducing the spread of this virus. Some of the ways to do this effectively are reducing the number of people you visit or changing how you visit with them. Using online voice chatting can be a great way to do this. Not eating or sharing food when visiting other people that are outside of your bubble. Again, wearing a mask to lower the chances of spread, washing your hands properly, regularly, and using common sense when the guidelines in the area you live in are vague. Additional PPE can be used, such as goggles, but unless you go into a place that requires these things, they are not needed for most tasks. That said, they will still reduce the spread of COVID-19 and should be considered depending on what you're doing. Please use your common sense. Additionally, while in Alberta, there is an online screening tool that should be done before you go out and about. You can also practice screening of each other on a regular basis. Some questions can include, do you have any of the symptoms of COVID-19? You can look at Alberta's website for more details on this, or our symptoms video. Have you visited anyone or live with anyone who is isolating? Have you been out of the country in the last 2-ish weeks, etc.? Finally, to help prevent the spread of COVID-19, support each other as much as possible, especially emotionally and mentally. COVID-19 is a very large stressor in other people's lives right now, and it's important that we keep each other stable and support each other so that we are more able to follow guidelines. Thank you.